Okay, so the morning of your procedure for your permanent radioactive seed implant, come in the front of the hospital and check in the main reception desk, and they're going to direct you there to what we call long stay day surgery. It's an outpatient area, but you're going to be here for a good part of the day, so that's where you'll start off. The nurses there will get you all ready to go, and then they'll bring you down to the operating room, where they'll be putting you to sleep, or they'll give you the spinal, but you'll still have a sedative, so you'll be, kind of sedated. So to do the procedure, once you're asleep, they're going to put you in the same position as when we did the volume study. So you'll be on your back, and your legs will be up in the stirrups, so the prostate's going to sit the same way. Okay. So to do this procedure, alrighty, they're going to have the ultrasound probe in the rectum, so they can see that prostate the whole time they're doing the procedure. And they use this bit of tissue here between the scrotum and the rectum. Up against your skin, we have what we call a template. It's like a square plastic. It's got little holes and coordinates in it. And then to do the implant, they have a plan ready for you. They know how many seeds they're putting in and where they're going to put them. So they'll go into the first position and they'll drop the seeds. Then they go to the next position and drop as many seeds as they plan to put there. They can put up to 100 seeds put in the prostate. It all depends on the size of your prostate. But you're not going to get picked 100 times, because the little needles that have the seeds have several seeds in them. And so once all the seeds are implanted, then the urologist that's assisting your doctor that day will come in, and he does a cysto where they look into the bladder. That's part of the procedure. And then they'll put a Foley catheter in to drain the urine until you're awake and back up into your room. Right, you're in the operating room for about an hour and a half. The actual implanting of the seeds probably takes less than half an hour, but it takes more time to get you ready for everything than the actual procedure. Now, we've gone through this bit of tissue with quite a few needles. So when you wake up in recovery room, you'll have an ice pack to your bottom. And they recommend for the first 24 hours when you go home that you just have a small ice pack to put on and off that spot, not continuously, but on and off. It helps to keep the swelling down. So like I say, when you wake up in recovery, you'll have the ice pack on. Once you're awake and you're comfortable, you'll go back up to your room. The nurses there will give you something to drink. Want you to drink lots of fluid, probably something to eat. And they'll take the Foley catheter out. And as soon as you can pass the urine, they'll let you go home. Now, everybody's different. Some people can pass urine right away. Some people take a little longer. It's pretty rare that people have to go home with a catheter. I can't say it never happens, but if that was to happen, that you weren't able to avoid and you had to leave the catheter in place, they would order the visiting nurse to come to your home to take it out a few days later. But most often people are able to pass urine, and then you can go home as soon as that happens. When you leave the hospital, you get a prescription for an antibiotic. That's standard for everyone. And usually the doctors will order a bit of an anti-inflammatory. Very often when patients take these prescriptions to the pharmacy, the pharmacist will explain that the antibiotics for infection and the anti-inflammatory is like for pain. And it is for pain, but more often, because the radiation is causing some irritation, you can have some side effects. And the anti-inflammatory can help reduce those side effects. So quite often people will call and they'll say, they're having some side effects from the treatment. And we'll ask if they've taken their anti-inflammatories, and they'll say, no, I didn't have any pain. Well, even if you don't have pain, if you take the prescriptions as they're prescribed, you may have less side effects. Okay. Once you're home from the hospital, it's just important to keep that skin clean and dry. Sometimes it's soothing to sit in a warm tub. Just be gentle with that area. Just pat it dry. There's no incisions. You won't be able to see any cuts or anything. There's little tiny puncture marks like when you have a blood test, but you really won't even be able to see anything at that point. Sometimes there is a little bit of bruising down below, so you may notice that. Most people say they feel good, like they really haven't even noticed that they had anything. You might not want to sit on a hard chair for a couple of days. But sometimes a few days down the road or even a week later, after the radiation's had a chance to work on that area, you can start to get some side effects. Now the radiation is damaging those cancer cells. They're abnormal. The body gets rid of them when they die. The normal tissue is healthy, but it gets irritated from the radiation, so that's when you can have some side effects. And everybody's different. Some people get a lot of side effects, some people hardly get any. Now, side effects to radiation are local just to the part of the body we're treating. So because we're treating the prostate and the urethra, or the tube that drains urine goes through the middle of the prostate, that's when you can have some difficulties passing urine. The things you might notice is maybe having to go to the washroom more often. Maybe the flow of the urine won't be as strong. Sometimes there can be some burning or some pain. You may have to get up at night more. So again, everyone's different. Some people find these side effects last for a couple of weeks. Some people find they last for a couple of months. If you're taking the medications and you're still having a lot of difficulty, you just give us a call, because there's other medications that the doctor can order to help. Sometimes people are on things like Flomax. It helps them to pass urine. If you're already on it, sometimes we need to adjust the dose. We're going to bring you back for a checkup, generally about 6 weeks after the procedure, and at that time, most times people's side effects have settled down. Okay. Now, if you were to find in the first week or so after treatment, after the procedure, if you found that you felt like you had to go to the washroom to pass urine, but you could not, if for some reason there was some extra swelling or possibly a bit of bleeding, if you found you could not go, you need to come back to emergency, where they would put the catheter back in place for, a few days. It doesn't happen very often, but it is one possible thing. So you need to know, if that happens, what to do. Okay. Now, the radiation has a half-life. The radioactive seeds have a half-life of 8 weeks. So for the first 8 weeks that they're implanted, they're at a certain dose. By the end of the 8 weeks, they're half as strong as from the day we implanted them. And every 8 weeks, they're again half. Just that first 8-week period is when we ask people to take some precautions. Now, the majority of the radiation is absorbed by your prostate. The prostate's inside your body. So the amount of radiation coming from you is low. You can be around adults. You can sleep in the same bed with your partner. You can resume sexual activity after a couple of weeks. They do recommend that people wear a condom for sexual activity for the first month. Just that rare chance you'd pass a seed. It's even more rare these days because the seeds are actually stranded together. Originally, when they started doing seed implants, these seeds were all loose, and sometimes there was a possibility that people could pass a seed. Actually, we never did really have a case of that, but so they do make that recommendation. But being around small children or ladies who are pregnant should be limited. That doesn't mean that you can't be in their company. 6 feet is a safe distance. If they had a Geiger counter, they would have to get 6 feet close to you before it would go off. So if you have little ones around, they can come and give you a hug. They just shouldn't sit on your lap for a long time or right beside you on the couch. If they sit on the floor watching TV or the other end of the dinner table, is fine. And if you went to the show or you went to church, you might want to sit on the end pew, in case there was a lady who was pregnant, near you. Or if you went to the dentist, you would want to make them aware in case the dental hygienist was working on your teeth for half an hour. So it's just good to make people aware. We do have these little lead lap aprons that some people will borrow for the first 8 weeks if you feel like you're around your grandchildren a lot and you need some extra protection, that you're able to borrow these if you like, and we have them here. You just ask your team members. Okay. The seeds are made out of titanium and silver. They're not magnetic, so you can have an MRI, and but they are radioactive, so you won't set off a metal detector, but if you went across the border or you went on an airplane, you could set off a radiation detector. So you're going to get a little card in the mail that says you're a radioactive seed recipient, and you may need to carry that with you for the first little while. Okay.